hospice was a gift, a huge gift for my own family. As my dad had Lewy body dementia. His quality of life had gotten so poor that the only way where we could justify continuing to send him to the hospital, it would have been for selfish reasons. It would have been more for us rather than for him. Welcome, everyone, to Dementia Doc Podcast. I am Dr. Miguel Rivera, and I am joined by my wife, Ganga. And today we are going to talk a little bit about hospice and the nuances of hospice care as it relates to dementia.
When we discussed this topic, we thought we do not want to give advice because it's a very hard decision to make when it is time to involve hospice. And yet, it's an important one. And before we get into all the intricacies, let's make the differentiation, or at least answer the frequent question: what is the difference between palliative care and hospice?
So, in hospice care, the general guideline is that in order to be eligible for hospice, the person needs to be expected to live less than 6 months. Now, that being said, then palliative care is also a part of hospice care. So, palliative care is care that is aimed at dealing with the symptoms. For example, it could be pain, it could be depression, it could be things that are affecting the quality of life of an individual. Now, somebody may be on palliative care and not be on hospice care. Like, for example, somebody may have a diagnosis of cancer, or they can have a diagnosis of end-stage heart disease. And as part of the care, they may involve palliative care to address any pain issues, depression, anxiety, insomnia, different things that can affect the person's quality of life. However, they may also be pursuing curative care, or they may be pursuing alternatives to try to improve their heart function, or chemotherapy, for example, if there is cancer. However, in hospice care, even though there is palliative care involved there as well, the emphasis is much less on curative things and more geared towards relieving the pain and suffering, what we call more comfort care.
Do I understand correctly that palliative care is basically a broader term applied to comfort care, and hospice is more of a smaller section of palliative care that is offered at the end of life, with basically 6 months to live and with no additional curative care?
I think that that's absolutely correct, yes.
Then I also have a question. Do you think that dementia care involves a lot of palliative care because there is no cure? And I know that you often speak about basically pursuing quality of life of your patients versus trying to cure their dementia or cognitive decline.
Yeah, absolutely. I think that basically all I do is palliative care because there is really nothing at this point that we can do. And, particularly with my patients that are more in the moderate to severe stages of the disease, there is very little, if anything, that can really be done for the dementia process themselves. So basically, what I do in addressing agitation, sundowning, depression, anxiety, psychosis, everything is geared towards treating the accompanying symptoms that come with dementia and trying to do what I can to help improve their quality of life. So, yes, by definition, that is exactly what palliative care is.
So then, what would be the difference of the person to transition on hospice, especially in dementia care?
So, the important thing is that once the person is on hospice, you're basically not trying to get them better anymore. Like, let me give you an example. I just had a patient who went to the hospital because he had a urinary tract infection. And in the setting of that urinary tract infection, he was like severely agitated with the family. He was hallucinating. He thought that there were people in the house that were, trying to, do them harm, etc. And when he went into the hospital, he came out like in a quite a deteriorated state. He really wasn't walking. He was wanting to stay in bed. He wasn't eating. He lost like maybe 10 pounds when he was in the hospital. So when he got out of the hospital, what the decision was made was to send him to rehab. So I went to the rehab facility to see him, and when I got there, he again wasn't eating. He continued to lose weight. He was fighting every time that they were trying to get him out of bed. And so I immediately contacted the wife and I said, I don't think that this is a good situation for him. He is really deteriorated. He doesn't recognize you anymore. He's totally agitated whenever they try to do any sort of personal care. He is not, he's refusing to go to rehab. We should not be forcing him to continue to quote unquote try to get better. My recommendation is that we get a hospice consult. And the wife eventually agreed that that was the reasonable thing to do. And hospice came, they did an evaluation, and they accepted him immediately. In particular because of the degree of his agitation, the dramatic decline that he had experienced, the fact that he wasn't eating and continued to lose weight were some of the parameters by which hospice made their decision to admit him to their service.
So, as far as I understand, when you say that when people with dementia go on hospice, hospice will not try to make them better. The difference between palliative care with you and hospice is that you are not trying to get their dementia better. It's not possible. But you still would try to make any other inflammation better, any other health condition better. But hospice wouldn't. If they're not eating, they wouldn't try to improve their appetite. If they're not walking, they will not send them to rehab to try to work on their walking. They will only provide a comfort care and measures to maintain their comfort, but they're not trying to prolong their life.
Yes, that's absolutely right. Because while they are, let's say, getting regular care from me, I am trying to get them to sleep better. I am trying to get them to improve their appetite. If they have a near fall or if they have a fall, we are going to, request for physical therapy to come in. If they have a pneumonia, we're going to treat it. But yes, once hospice is involved, then it's more just comfort care, making sure that pain is addressed, make sure that they're having as good a quality of life as they possibly can without doing those things that we just discussed.
What do you think makes it so difficult for family members to say, okay, I think it is time for hospice?
Yeah, that is such a difficult decision for most of the families that I deal with, and multifaceted. I mean, there's many things. I think that guilt is one of the main drivers of the hesitation to sign up somebody for hospice. Also, the idea of I want to make sure that I'm not quitting too soon. Like wanting to give the loved one every opportunity that they have to quote unquote get better. Also, it raises the issues with the person's own mortality. How is it that the particular family member feels about their own mortality? That can many times reflect on the decisions that they make for their loved one. And yeah, absolutely. Each person is different, and I would say that most of the family members definitely struggle with the um, with making that choice of saying, okay, this is really the beginning of the end, and I'm gonna go with it.
Yeah, I think I want to pick up on your statement that it's how people relate to their own mortality. I would think that sometimes actually it would be easier for them if that's their own mortality, they may choose hospice. But to give up on a family member, the guilt that you mentioned may be even higher, that I'm giving up on you versus
Hmm.
him doing the best choice for you. And I think
Yes.
that, and I would think that even the creation of hospice comes from the idea that sometimes to prolong someone's life brings about more suffering than to say, hey, maybe it's time to stop trying and just provide comfort care.
And I think that in general, I think that the medical community accepts the fact that in our society, we tend to look at death as not a part of life, but as a failure. And I think that that feeling from the physician's part to do what they need to do or whatever is possible or whatever they can do to keep the patient alive at all costs. I think that that is many times in direct opposition to what is best for the patient, what is most humane for the patient, and really what the best decision for that patient is. So I think that to have a deeper understanding that death is also unavoidable, undeniable part of this experience that we also call life. And that just as, we come into the body, and we are born from our mother's womb, at some point, it is just as natural for us to transition into this stage that we call death.
But I want also to highlight that no matter how much we understand that, when it comes to our loved ones, it's hard. It's heartbreaking, it's painful, there is grief, and it's really, really hard to make that decision. But maybe realizing that hospice is there not to give up, but providing more solutions to just trying to prolong someone's life sometimes brings about more suffering. Like we just recorded podcast with Teresa, and if you want to see that episode, she speaks about her dad not wanting to give up on her mom, while even her mom's wishes were to not being fed through the tube, to not trying to prolong her life. And those were the hardest months of her dementia journey. So to have the understanding that hospice is a gift, and yes, it's hard, it's heartbreaking. That's why, by no means, I would say, hey, for sure, choose hospice, done deal. No, it's never like that. And yet, hospice is a gift.
Hospice was a gift, a huge gift for my own family. As my dad had Lewy body dementia, and as part of that disease process, and also partly because of some of the medications that we were using to manage some of his symptoms, he kept getting these serious bouts of aspiration pneumonia. And during his last visit to the hospital, he was severely delirious. He had ripped out his IVs. There was blood everywhere. When I got to the hospital, they had him in restraints. My mom was there next to him, and I walked into the room. He looked at me and then turned to my mom and said, "Who is that man?" That I remember that as a real difficult and significant time in my dad's journey and in my journey with my dad. So he eventually, after maybe 10 days in the hospital or something like that, of just a terrible stay in terms of he was agitated, confused, disoriented. And so towards the end of his stay, my mother, my sister, and I got together and we're like, where do we go from here? You know, what is it that we're really trying to save? We were all in agreement that his quality of life had gotten so poor that the only way where we could justify continuing to send him to the hospital, it would have been for selfish reasons. it would have been more for us rather than for him. So, with tears in our eyes, because we really knew that once we made this decision, that there was no turning back. And that we were basically saying, the next time that he has an aspiration pneumonia, we are not going to send him to the hospital. We are going to call hospice in right now, have him come in, and then whenever he develops his next bout of aspiration pneumonia, we are going to just get the services from hospice. And that is exactly what we did. We consulted hospice, they admitted him into the service. They were incredible in so many ways, and everybody from the social workers to the nurses, the doctors, who provided first the in-home care while he was still at home, and then eventually when he moved into the Marion County Hospice House, and how they supported him and loved him through the last days of his life. It was, yeah, you said it. It was truly, truly a gift.
Yeah, I remember. I remember being there during the last 3 days of his life. And we were privileged to be there when he took his last breath. But I remember entering that hospice and thinking, how do people work here? How do they encounter death every single day? And I expected to have this air of gloom and doom. And it wasn't so. Somehow there was something so sacred in that space. And I remember when the doctor came and said, I think your dad right now is transitioning. And so we are stopping to hydrate him because at the end of life, hydration helps people to get into a blissful state and it helps them to leave the body. And everything she said was so non religious or, like she was not trying to be spiritual counselor. She actually talked to us as a doctor. He couldn't talk, but he could hear when people talked to him. And they were talking to him. Every single nurse who was coming in was sitting down at his level and saying, Mr. Rivera, I'm here to change your shirt. Mr. Rivera, I'm here to check your vital signs. We want to make sure that you're comfortable. They were talking to him like he was a person in conscious state while he was completely unresponsive. And I just thought it is like some people meet small babies into this world and greet them, and some people escort souls out. I remember there was one nurse who said she used to work in Boston area, and they had this program, Nobody Dies Alone, where people could come to hospice and sit with somebody who was about to die. And I just thought it's the care and understanding that these people have, and also the comfort that the family can get through those days of grief. And again, nothing can make it easy. Like, there's nothing that I think can take the blow of losing your loved one. But as much as someone can support your loved one and your whole family, that hospice was absolutely amazing.
Yes, I couldn't agree more. I think that their services are truly invaluable. And and you know, I would say that in my experience, I think that we really wait almost too long to get somebody on hospice. I mean, again, for so many reasons, right? That we talked about. But I think that the hopefully this video will help our listeners to um, maybe entertain the question before the time comes, so that they can be aware of first of all their own feelings about how they feel about hospice, their own feelings about any grieving or any feelings for the particular person, any, like I mentioned, any feelings of guilt or particular, um, preconceptions about the process. So anything that could be done ahead of time to help resolve some of those questions so that when the time comes, then it would be, let's say, a little bit less difficult than it normally would have been had those things not been considered.
Yeah, and there's a phenomenal book by
Mm,
Atul Gawande, Being Mortal. It touches upon a lot of those issues. And yeah, and again, it's not that it's going to make it super easy to make that decision. And I also want to mention that I come from a country, I'm originally from Russia, where palliative care is not developed still. I watched recently an interview with a person who established hospice in one of the regions and how hard sometimes it is to even educate nurses and doctors into palliative care. I do not mean to criticize Russian medical system right now, but it takes a certain mindset to be palliative care doctor and nurse. And if you're in a country where that is available, it's a gift. When my grandmother was going through cancer, I was horrified looking for hospice because there was not one that was providing a good service. So, and then having this experience with your dad, it is an enormous gift. So, choosing hospice is often not to give up, but on the contrary, to offer this sacred ending connection with your loved one versus just more running around trying to fix things that are not fixable, just like you had to decide with your dad. So, as much as I understand there are difficulties in every medical care, but I think I want to remind people, especially in US, that you have so much available to you. And hospice is one of those gifts.
totally. I cannot imagine my family going through my father's dementia without having the services of hospice available to us. And also, it's really important to mention that hospice is not only about the services for the patient, but also services for the family. Like I know that the hospice of Marion County, they were available for my mom, for my sister, for myself, with grieving therapy and education. I mean, they certainly took their time to make sure that we understood everything that they were doing it and why they were doing it. So I think that that is an extra layer um, that is frequently forgotten, which is hospice is not just for the patient, but it's also for the family.
So, if you had your own experience with hospice or having to make that decision, please share them in the comments under this podcast on YouTube. We appreciate you being involved because, as we said at the beginning, there is no one right answer. It's not a cookie cutter. Life is quite individual. But I think the more we know each other's experiences, the more we can be empowered or comforted to make those choices.
Absolutely. And again, if this podcast has just even raised the question in your mind about what would you do, we have succeeded. Because the time that you spend becoming clear in your own mind about how is it that you feel about the process, what is it that your loved one, what their wishes are, um, it will definitely help you to make a good decision without hesitation or with less hesitation.
So, thank you for listening, and we'll see you in the next episode.
See you next time.